Good evening, everyone. Okay, so the COVID-19 pandemic changed healthcare in many ways that none of us expected, and it forced hospitals to rethink how they deliver their care, um, prepare for future emergencies, and manage finances. Now, before the pandemic, many hospitals operated under business models that depended on predictable patient volumes and elective procedures. When COVID-19 happened, it kind of exposed weaknesses in those models. And it just showed that hospitals needed to be a bit more flexible. Um, and to me, the pandemic accelerated all of these changes that were really already starting to happen. Um, so one of the biggest disruptions was canceling elective surgeries and procedures. So elective surgeries and procedures are like one of the largest sources of income in a hospital. But during the pandemic, hospitals had to postpone them and make room for COVID-19 patients. Um, so it created major financial losses, and many hospitals struggled to cover operating expenses because they were caring for patients and bringing in less revenue. So administrators had to find ways to reduce their costs without sacrificing patients' care. Another thing that grew rapidly was telehealth because before COVID-19, many organizations were like slowly trying to adopt virtual care. But during the pandemic, they became essential. So patients needed access to healthcare while they were staying at home. So hospitals invested in telehealth, in telemedicine rather, um, and the technology behind it. So today, telehealth continues to improve access for patients who have transportation issues, like in rural areas, or would simply prefer virtual appointments. I think telehealth is one of the most positive changes that came from the pandemic. I love telehealth. I use telehealth. It's very convenient, especially for someone like me. I work in the ED overnight. So during the day, I sleep. So I really don't have time to go to a lot of doctor's appointments. If I do, um, it will have to be on like an off day. And of course, on my off day, I have to do everything else that I don't do during the week. So I think that that's one of my most favorite changes since COVID-19. Hospitals have also realized that not every service has to be provided in the hospital. So more care shifted to like outpatient clinics, surgery centers, urgent care centers, home health services, and it allowed hospitals to reduce their costs while making it more convenient for patients. And because of that, administrators have continued to invest in outpatient services. There were also staffing changes. Of course, healthcare workers experience burnout. Um, Many nurses, physicians, and other healthcare professionals like left the workforce, understandably. Hospitals were experiencing staffing shortages. Employee morale was down. Of course, so now at this point, administrators have to increase recruitment efforts, offer hiring bonuses, retention incentives, wellness programs, things that will keep the employees there. Workforce planning became like a really big thing after COVID-19. There were obviously supply chain problems. COVID-19 exposed the weaknesses in healthcare supply chain. Administrators had to develop new relationships with suppliers. many hospitals began to keep large emergency inventories instead of relying on just in time delivery systems. And also, supply chain management became a priority after COVID-19. Infection prevention, and emergency preparedness. So, infection prevention became more important. Hospitals redesigned their workflow to separate infectious patients from other patients, different screening processes, visitor restrictions. Um, Hospitals invested more in ventilation systems and isolation rooms. Administrators also developed emergency preparedness plans for future pandemics and public health emergencies. So instead of reacting to a crisis like we would have in the past, we're now planning for the crisis ahead of time. Technology and data analytics. Hospitals relied on EHRs, predictive analytics, and dashboards to monitor patient volumes during the pandemic. Um, AI and predictive modeling became more common after the pandemic because it was a necessity during the pandemic. So digital transformation is no longer an option for us, it's a necessity. There were financial changes. Hospital leaders had to rethink how they manage finances. Many organizations diversify their revenue sources instead of depending solely on inpatient care. Because obviously now there are not that many inpatients, because we have all these other ways for people to be seen by a provider. And so now financial resilience is a really big part um, of the healthcare industry as well as clinical excellence. We now focus on patient experience. That is actually my job in the ED. Patients now expect healthcare to be more convenient. They, like I said, they want to do online scheduling, virtual visits, digital communication, faster providers. Hospitals have have responded by improving digital services. And patient satisfaction has become a huge part of the healthcare industry, a big priority. I know at my location, it is number one. They are extremely involved and dependent on our department. Patient experience is everything to them. Of course, the focus is on the patient's health and treatment, but right under that is patient experience over everything. They also had leadership changes, and the way that leaders make decisions. They become, like I said, more flexible, and flexibility has become an important part of leadership in healthcare. So overall, COVID-19 permanently changed the healthcare industry and business models. Hospitals can no longer rely on just inpatient care. We can no longer just respond in the moment. We must plan for everything. But I do believe that the pandemic made healthcare stronger in so many ways. And it forced organizations to adapt faster than they would have before. So moving forward, I hope that we continue to innovate and remain flexible, because I feel like it's done nothing but strengthen our industry. Thank you guys. Have a good night.